Hello, everyone. We're having a little bit of technical issues here. Thank you for hanging out with us. We're going to go ahead and get started since we're after the time here. Hopefully, my colleagues will join us. Um, my name is Keith Bubbelow. I am the senior analyst here at Stroudwater. If you watched our previous session, I worked on some of the data that were in the that our closure study that we're doing. I like data, I like maps, I like data visualizations and helping our clients to see their data. So it was a very great opportunity when we partnered, Stroudwater partnered with NRHA and NOSOR to put together the Congressional District Dashboard that focuses on rural health, which is what I'll be presenting today. So let me just go ahead and share my screen. Um, Hopefully everyone can see that there. Let's just get to our, okay. Can everyone see that now? Hopefully. Alrighty. Perfect, perfect. Okay, all right. Let's try that again. There we go. All right. So the background for this, as I said, it's a collaboration between NRHA and NOSOR. We wanted to create something that was comprehensive, that was free, importantly, and a resource for rural health data, for data across the states, counties, and congressional districts, specifically looking at rural. So the goal was to have a resource for board members and providers, policymakers and other partners and hospital executives with some rural health facts specific to their state and to their congressional district for advocacy purposes and for just knowledge and for advocacy policy making. So we wanted to use things that were publicly available and recognizable to everybody. So everything that you see in here in this demo is going to be public data. And some of the data sources that we used are things like HRSA, the cost reports, public cost reports data, the MPI file for provider information. We used data from the CDC for some of the health outcomes and health factors. Also using Robert Wood Johnson County Health Rankings, which I think a lot of people are familiar with. And then we used the United States Census for congressional district boundaries. This is initially based on the NRHA's pillars that they came out with a few years ago at one of the conferences, which were looking at infrastructure, workforce, and health equity and access. Since then, we've kind of expanded those to include some more measures that we think are important for rural providers and rural advocates. Um, Speaking of rural, there's a lot of different definitions of rural out there. We work with rural hospitals and communities, and we know that there's many different definitions. For this dashboard, we used HRSA's definitions. So for the infrastructure, it's looking at where the facility is, whether it's rural or not, based on their definition. If for a provider, for in the workforce, for a doctor, a nurse, what is their zip code? Is their zip code rural or not? And then for the CDC data, it's county based, so it'll be if the county is fully rural or not. And these are all according to HRSA and the Federal Office of Rural Health Policy definitions. So let's get into the goals here. So the way that this dashboard had unfolded in winter of 2024, we introduced the first version of it at the Policy Institute in Washington, D.C. And then that was specifically for us to just receive feedback from everyone, say, "Hey, this is what we're doing. What do you think? What can we add? What can we change? How is this working for you?" And that input from users was critical into developing what I'm going to show you now, which is kind of the updated one from this year, earlier this year. I will point out that we are still seeking input from this because it's a resource for everyone. We wanted to make it as user friendly as possible. So, and I'll show you when we get into the demo, there's a little contact information there that you can put in if you wanted to offer some suggestions, which we'd love to hear. So the version 2 goals: expand and update the measures based on that feedback we got from users initially. We released it again at the Policy Institute in DC this past winter. And then we had in February we added a few other things of just to support the what the Policy Institute was focusing on, which I'll show you here. So the feedback that we heard from our initial release was very positive. Some of the requested additions included things like looking at nursing coverage, broadband access and coverage in those areas, in rural areas, is very important. One of the health professional shortage areas, this was specifically asked by the leadership at NOSOR, to have kind of a place where you can get the HIPSAs from the other sites, but just having it in one spot, which is very helpful. People asked if we could add more facility types beyond what we were looking at. And then we added some prevention measures from the CDC that were available, more social determinants of health, and then national benchmarks for some of the measures that we were showing at the state level, and then a Medicare Advantage penetration was a recent one that we've added. So let's talk about the dashboard. The first tab in the dashboard covers infrastructure. So what I'm going to do is I'm not going to run through each of the tabs, and then we'll go into a live demo, and I'll show you how you can use this for your own purposes. So the infrastructure is going to look at your state. Each state has its own tab or own drop down there in the upper right-hand corner. You'll get your congressional district map up in the upper left-hand corner, which is a filter that you can use. And then the colors here are: the red is your rural and the blue is your non-rural. So it's split out like that. So this shows where in your state are your ambulatory surgical centers, your critical access hospitals, your short-term acute care hospitals, FQHCs, SNFs, rural health clinics. And then we added some in the most recent release: home health agencies, psychiatric hospitals, and then rural emergency hospitals if you have any in your state. And then there's just a facility count for all that are listed, so you can see how many of those different categories are within your state. The next tab is utilization. Now this breaks down some of those categories. We don't have things for all of these categories because it's not publicly available in some cases. But this looks at hospitals, FQHCs, rural health clinics, and skilled nursing facilities, and some of the volumes that are associated with those. This is important because when you look at individual states and specifically in congressional districts, you can really see the split between rural and non-rural as far as this utilization goes. And it really underscores the importance of rural in our healthcare environment, especially now. So for these factors, we're looking at the HCRIS data, which is the Hospital Cost Report Information System, directly from CMS. Here at Stroudwater, we download those every quarter, and we've got, going back several years, we actually used some of that for our the previous session in our closure study. And this is going to show the number of beds that are in for each of those categories, days, including labor and delivery days and nursery days, kind of as a proxy for births, because births is a little bit hard to get by in a public data set. And then visits for your clinics, for your FQHCs and your rural health clinics. The next tab in the dashboard is workforce, and so this is looking at the MPI file, the National Plan and Provider Enumeration System, which is available publicly again through CMS, which lists all of the any provider with an MPI number that's certified, I think, for Medicaid or Medicare. And what we did is we took that file, connected to it, and looked at the individual doctors and nurses, physicians assistants, dentists, therapists, kind of grouped those into these kind of higher level provider categories of behavioral health, family medicine, internal specialties, surgery, surgical specialties, nurses, OBGYN. Oral health includes dentists and dental hygienists. So it kind of gives you a broader overview. This data is available, at the more granular level, if anybody is interested, and we can certainly help you with that if it's something that you would really need. This is going to show that there's the count of those providers based on the location of their primary office. And in the lower left-hand corner there, it'll show kind of the rural versus non-rural, and then the charts also will show that percentage. So again, you get a real good split of like which ones are in a rural area versus non-rural. And it becomes more compelling as you get into the congressional districts. Our next tab is the shortage areas. As I said, this was a specific request from NOSOR, from the leadership of NOSOR. This is available through HRSA. They have a website. It's got a lot more detail in it, but what we wanted to do is kind of just give a quick overview of what those shortage areas are by state, and then having them able to be, filterable by your congressional district. Now, these are at the county level, and what it's breaking it down into primary care, mental health, and dental health shortages. So as you can see in this example in Alabama, it's pretty much the entire state has one of the three of those shortage areas. You can break these down by the different designation types in the lower left-hand corner there. So looking at correctional facilities, FQHCs and FQHC lookalikes, geographic HIPSAs, populations, specific populations, etc. So that is filterable there. And I'll show you in the dashboard demo about how you can get some more information from this map just by mousing it over, including the HIPSA scores. Prevention this is coming from CDC and also from, in some cases, from Robert Wood Johnson, as I talked before. So the CDC has a really great resource called CDC Places, which is small area estimates of different measures. And it's fantastic because it goes down. In this case, we're using county level. It actually goes down to the zip code level, which we use in some of our more specific analyses that we do for our clients here at Stroudwater. But these includes things like annual checkups. How many of your population are getting their annual checkups? Their cholesterol screenings, other screenings like cancer, colorectal cancer. Very important dental visits. Who has health insurance? Who's uninsured? Who's taking high blood pressure medication? And how many women are getting regular mammographies? And what this does is comparing the county to the state benchmark. So in this case, we're looking at visits to doctors for a routine checkup. What's the percentage of adults within each of those counties that have done that? The state benchmark is 78. The national benchmark is 74.2. This is comparing to the state benchmark, so you get more of a localized look at it. And you can see kind of where the orange areas are below the state benchmark and the blue areas are above the state benchmark. And that'll change as we look into the live demo in just a minute here. Health outcomes. The measures included in here are tooth loss. So again, going back to dental health, this is tooth loss for adults over 65, cancers, heart disease, depression, diabetes, overdose deaths, people with high blood pressure, infant mortality, life expectancy, obesity, suicides, and again, that national benchmark. And then looking at comparing those counties to the state benchmark. And then looking at whether those counties are rural or non-rural, and I'll show you that in a minute, how we can filter those out. In the lower left-hand corner, the measure there is showing basically the same as the map, what the variance is from the state and which of those counties are fully rural compared as according to HRSA's definitions. One thing I want to point out, and this is in another one, the next one too, is that some of the measures are not available for every county. Some of them might not be available for the state too, and that kind of depends on what the data source of those that is. Sometimes they're just not available. But for the most part, they are. So health factors is a kind of a newer one that we added as well. So looking at aging population, where are the people that are over 65? Who are the people, what are the percentage of people with any kind of disability, whether it's, just overall, do they have a hearing, cognitive disability, independent living disabilities, things that are important for health factors, including insecurity, food insecurity, housing, transportation barriers, very important measure for health outcome and health equity. Their minority status, people in poverty, single parents, things like unemployment, and then maybe some other, and there are some others in there as well that are important. So this gives you a really good lay of the land of kind of where those important populations might be, and how you measure your area will measure to the overall, state. And then finally, in this dashboard, we're looking at Medicare Advantage, obviously very, very critical issue for many providers. This looks at what is the penetration of MA plans by county, again, compared to that state average, so you can see where plans are more prevalent or not. Right now, the national benchmark, this is as of December of 2024 was the data we have in here. So the national benchmark was about just over 50%. And in this case, in Alabama, it's statewide, it's 59.9%, higher in some counties and lower in others. And then lastly, what I want to show, well, in this round here, is that each of these tabs are in these images can be downloaded. So you can take these images right from our dashboard, save them as an image. You can make a PDF or a PowerPoint from them. After you've selected your state and your district, and then drop them right into your CHNAs, your grant applications, or any other kind of board presentations, anything that you want to do, it's available there. It's all in a Tableau dashboard, which some of you might have used. So if you're familiar with Tableau, you'll understand how that works. So how is this dashboard being used? So some of the feedback that we've collected overall since we've launched this last winter, some of the things we've got, people are using it in community presentations. Somebody was using it to help a local club, a Rotary club, to understand the communities. So for donations and support. This guy who's a former hospital CEO is retired but continuing to support healthcare in his area, which is great. Um, Grant writing, we've got a lot of feedback from grant writers who are using this and just appreciate having all that data in one spot. Policy messaging, which I think is was our initial focus of this. Just again, arming people who are advocates for rural healthcare to have data at their fingertips, so they don't have to search for it. Um, State offices of rural health are using it. Looking at patients, just understanding your patients. What is your area look like? What do the counties around you? What does your county look like? And then obviously to share with your legislators, particularly now with all the changes happening in Washington. This little tab up here, this highlight here. So when I'll show you the dashboard. This is a pop-up that you're going to get from our website where the dashboard is located. We'd like to know how you're using it. And if you'd like some updates, you can put in your email there. Um, so now I'm going to switch over to the um, dashboard itself. Okay. Just a minute, please. Okay. So Stroudwater.com is our website. You can find the dashboard here, and I'll show you where it is. We'll tell you a little bit about Stroudwater here if you're interested. Under Services, the dashboard is located under our Improving Rural Healthcare with Data and Analytics, and it's right here, Rural healthcare state and congressional district. So let's go back to that. As I said, when you come to the dashboard here, it's going to give you there it is, little pop-up. Please feel free to fill that out if you want to, and let us know how are you using it. This is going to give you all of the information that I just kind of talked about, kind of laying out what the sources are, and how this is being used. So again, there's the state offices of rural health, hospital leadership, policymakers, a little bit about our partners in this, the NRHA and National and NOSOR, great partnership. And then I just wanted to point this out. This is some feedback. This is what we've been using from the beginning to get information from our users. This goes directly to me. So if you want to fill this out, if there's something that you have a question about, something you'd like to see, something that doesn't make sense that needs to be changed, please feel free to fill that out, and we'll get right on that. It's been very, very valuable to have that kind of feedback from our users. So the dashboard is right here in the middle of the page, and just to make it a little bit easier, I'm going to open it up in Tableau Public where it lives. Let me get over to that screen. Okay. And I'm going to go to full screen just to make it a little bit easier. All right, so hopefully everybody can see that. I think we are good. All right, so here's the dashboard. And in this case, I'm going to click on, let's use Ohio as an example. So here's our infrastructure tab. As I said, you've got your navigation map up here for your congressional districts. You can click on your congressional district and the map will filter on that district. And then all of the charts and tables will change for that. So in this, the second district of Ohio, pretty rural, looks like you've got most of your facilities are in rural and non-rural. This map here showing the locations of those facilities. If you mouse over it, you can get some more information from them. So the site name, what's the provider number, the category, the city and the county, and the status. Again, that red is going to be your rural. If you click on it, you can get a little bit of a filter there to show that there. And the blue is going to be non-rural. One of the things that's nice about Tableau, I like, is that if you want to click on a couple of these, you can do this and kind of highlight some things you might want to show. And then you can download this image by itself and put it into your presentations. So it allows you to do that, filter a little bit there. Oops, got out of my full screen there. Okay, so again, that's counts of our infrastructure. Heading over to utilization. Again, this is looking at those discharges and days and visits among this different the infrastructure subset of that infrastructure. So critical access hospitals, PPS hospitals, and your clinics. Again, this map is going to show you all of the locations of all of these different types. You can get information by clicking on some of the tables. Everything is basically a filter. And we'll show you the location of all those things. So this is looking at our rural health clinics. And then again, showing the percentage of those that are rural versus non-rural. And your congressional district filter is here. It allows you to select. If you don't know where your district is and the map is a little tight, sometimes it is in some of these larger states, you can use this drop-down filter, which will do the same thing by just showing the list of the districts there. It's a little bit easier. So moving on to the next tab is workforce. Again, you've got your map there. Those categories, the classification categories that I talked about, roll-ups of those different provider types. These are your doctors, your nurses, PAs, dentists, therapists, etc. And looking at that percentage of where, who's in rural and who is not. Down at the bottom, you've got just a count of the total workforce. So just total individuals, um, um, and where they're located. Again, we'll let's see, look at Southern Ohio. And you can see that this is in a district that has, quite a bit, majority of their providers, um, in an area that is considered rural. So very, very important. And the highest looks to be, in terms of total counts, is nurses. All right, next tab, shortage areas. Um, as I said, this is kind of just a high level look at the real detailed stuff that you can get from HRSA. But this allows you to look at, on these three major categories for shortage areas, which counties have any kind of shortage area. And mousing over these different counties will give you a little bit of information about the HIPSAs that are in there, and the score. So the higher the score, the higher the shortage area, um, for primary care, mental health, and dental health. Kind of list them, as in high to low from scores. Um, you can also filter this display if you wanted to just look at things that are, say geographic HIPSAs. Where are those located? Um, that You can look at HIPSA populations. So this breaks down this kind of by designation type, um, within the state. And again, as mousing over that, you'll get some more information about which ones are in there. If you prefer, you just wanted to look at primary care by itself, you can do that as well. It'll give you just a larger map, um, and show you a little bit more, closer and more detail. And again, mousing over is going to show you what those HIPSs are within that area. One other thing that we have here, since we're looking now at county level data, I'm going to clear everything out. We'll go all the way clear, show everything. We have, we'll go. Clicking away from the map anywhere on on the dashboard will clear out what selection you have if you use the map to select. So right here we have that rural status. So this is looking at, um, uh, what does HRSA consider as rural counties, within Ohio in this example, or non-rural. So you can filter that way as well. All right, so the next 3 or 4 tabs kind of have the same basic layout, of comparing the measures to the state benchmark. And again, the orange is going to be lower than the benchmark. Blue is going to be higher. That's going to switch. It'll be the same, good or bad, basically, if you will, even depending on what the measure is. So some cases blue is a good number. Sometimes um, it's a lower number is blue, and that's good. So blue is always a positive. So again, this is looking at just annual checkups. So these are prevention measures. So we've got the different screenings. Let's look at dental visits, for example. Um, we'll show you, where are the areas that are below that state benchmark of 62.1 percent of adults. These are people over 18 who have visited a dentist or a dental clinic, again, according to that CDC data. Um, but by the way, the source is always going to be down in the bottom lower left-hand side here of the map, of the dashboard, in case you're wondering. So, and again, looking at those different congressional districts, everything will kind of reset, and you'll be able to see, just the district by itself, and what are those one of those measures there, the variance from the state. Again, mousing over the counties themselves will kind of give you a little bit of more information. In this case, we've included a population estimate from the census, what the measure is, and the variance, just a little bit more detail, if you are so inclined to see that. So this is looking at all those other categories. Let's look at mammography, for example. I just want to show how this will change, based, and it'll give you the definition up here. So, this is mammography use among women of this age, between 50 and 74. Everything is adjusted to that population when we're looking at the state benchmarks, and national benchmarks. Um, to show areas that are fully rural, you can use this little highlighter, and it'll just highlight the counties that are rural, according to HRSA. All right, let's look at health outcomes. Again, this is looking at these measures based versus the state benchmark. I'm going to look at high blood pressure. So in this case, high blood pressure among adults. These are adults, people over 18. State benchmark is going to be 32.4% of that population. The national benchmark, just for reference there, is 29.6. And this shows whether the people in the county are higher or lower than that benchmark. So you can kind of see where there's some areas where it might be a little bit more of an intervention needed for blood pressure, and some monitoring. Let's look at this Congressional District 8, and that'll filter those counties. Just so the counties, obviously, county boundaries are not going to follow directly your congressional district boundaries. They're a little bit different. So in some cases, a county might be included in two different districts, but it lists give you, if it's touched by the district boundary at all, it's going to be included. Just to keep that in mind. So then looking at health factors. So the factors here, these are things that are going to influence, personal, economic, or environmental aspects, conditions that can affect your health. So again, aging, those disability categories that we talked about earlier, education. This is looking at the number of adults over 25 years without a high school diploma. Um, uh, let's look at things like transportation barriers. Um, so this is, self-reported lack of reliable transportation in the past 12 months. Again, this is coming from the CDC. The the state benchmark is 9% of adults. You can kind of see some areas that are higher or lower than that state benchmark. One thing I do want to point out, if we look at, actually, I'm going to go back to health outcomes just to show that there are different data sources in here. Yeah, in the case of life expectancy, most of the stuff is from the CDC, looking at their 2024 release. In this case, the life expectancy is from Robert Wood Johnson, and it changes down on the lower left. All right, and then lastly, Medicare Advantage penetration. So again, this is going to be looking at the state um, uh, at Medicare Advantage penetration, so the number of percentage of eligible persons enrolled in an MA private plan in the state. In this case, green is going to be lower than the average, and blue is going to be higher than the average. And you can really see, where those variances are in a state like Ohio, where this, Northwest Ohio has a much lower MA plan penetration than the eastern side. You can sort here if you wanted to look at the county level, which are the highest counties. Looks like Stark County here is the highest, um, right there. And again, looking at your specific congressional districts, we'll break those down, those counties that are touched by that congressional district, and you can see how that variance is based on the district. All right, so let me exit out of this. I just want to show real quick what you can do, and I'm gonna go back to just our regular dashboard here. So again, you can use this dashboard right on our website. If you do click on the public, you'll get a larger screen there. It's a little secret if you want to know, because sometimes it's hard to see the entire dashboard if you're looking at a laptop like I am. But here's where you can download those images. So click on this. It'll give you an image, whatever is on that particular dashboard, or you can get it as a PDF, or it'll make you a PowerPoint. Um, Once the state is going to be the same every time. So just pick a state once. You will have to use probably go through and pick your congressional district each time. So just keep that in mind. Um, so that is the dashboard. And let me go back to my presentation. All right, so I just want to talk about customization. So Stroudwater has, since we've rolled this out, we've entertained some requests from different states, different organizations within states about state-specific versions, and using kind of a lower geography. So in the case, rather than looking at county, we can look at zip codes. You can do it by hospital service area, which is a possibility. Specific zip codes rather than the counties, looking at additional facility types or for providers or health measures, or using really, you can use state legislative boundaries instead of the congressional district, which is an option. So those are customization is something that we can do. We're in talks with some states, as I said. So if it's something that you might be interested in, please let me know. You can use that contact sheet that's there. That would not be a free version because we have to work on that a little bit. But the benefit of that is that you can use data that's not necessarily publicly available because if you have like a health information exchange, or some state-specific dashboard, or state-specific data sources that you might want to show, you can really get some really great information that might not be available to the public, and we can work with you on that. So please keep that in mind. Oh, there's Amy.
Alrighty. Hey, thanks, Keith, for joining in. We just appreciate this insightful information you have shared with us.
Mhm.
And did you want to kick off a polling question or go do some Q&As, or we are
Yeah, I
tight
would
on
say
time?
we kind of went through the polling, skipped the polling questions, but if you wanted to
Okay.
do, first of all, I'd like to know one of the initial polling question we had was how many people have actually heard of this. That would be kind of, can you run that one?
Yeah, let's run that one. Not a problem. Because I know we got started late and you jumped in a pinch when I couldn't get in.
Yeah.
So here is our first question. But before today's presentation, how familiar were you with the Congressional District Profiles dashboard? All
Looks like
right.
I've
Looks
never
like
heard of it.
some. I heard of it, but not seen it. So it does look. I'm going to end the poll real quickly here and share the results. So it looks like almost close to 80% of you, 79%, have never heard of it. So we thank you for sharing that with everyone, Keith, because I'm always fascinated by, as you were doing it, I'm like, well, what about a different state? So I know that
Yeah.
when I talk to people about it, they are very interested in it. Did you want to run your other two polls then real quickly?
Yeah, please.
All
Let's
right.
look at the next one. This is just,
And
go after going through what part of the dashboard do you think is most relevant to your community? Um, and there is a all of the above view.
yeah, there are several choices there. And then you did have a question as the polls kicked off. You did have a question about, I note that you captured general practice along with other types of primary care. What about including specialty practice? If you wanted to answer, that was one question that we had received through.
We can, yeah. I wonder, is it any particular specialists or is it just specialists in general? That would be a good, if you wanted to contact us and let us know,
Yep.
you can use that on the dashboard. I'm actually gonna, or Amy, I don't know if you can do this. Let's put the link to the dashboard in the comments.
Yeah, if you want to put it into the chat box,
Yeah, let me do
if you've
that.
got that link, then you can just do that. Plus, we'll also make sure that when the information is sent out, uh, that it has it, when the information is sent out, we have that information there. And then it was like,
Okay, hang
I
on just a
am,
minute. I'm gonna go ahead and throw that in.
All right. So it looked like a lot of people wanted all of the above. So some good information that was shared. So, and what I will say is, in working with Keith, I will tell you he loves to pull the data and pull the information for you. So very insightful there. And then I will kick off the one. I'd like to learn more about developing a customized dashboard for my community. That is the final poll question that's there. Keith has put the information into it. Oh, I didn't stop sharing of the other one. Stop sharing, and now I'll launch this poll. So if you are interested in learning more about that, you can put it, and we will be sure to reach out to you about this.
Yeah, absolutely. Are there any other questions? Is there anything in the chat here that I didn't see?
All right. In the Q&A, I will go look at that. I might have ended the poll a little too soon. Sorry about that. But there are questions in there. The specialty care, with specialty care being more costly than primary care, the question would be why not group all non-primary care into a category? So that was the clarification on that.
Oh, yeah, that's a good suggestion. Yeah, yeah.
Yep. So thank you all for that. I'll wait a minute before we end it. But just want to say, what we're going to do now is we will shift to our final session where we're going to talk about my favorite revenue cycle. So it is an area where many rural hospitals have significant room for employment for improvement. And I will be joining my colleague Ryan Brenneman, and we will be talking about that. And we look forward to seeing you over there. So thank you again, Keith, for sharing it because the data dashboard is some good information. Do feel free to reach out after if you're attending this, to reach out to that Q&A portion, not Q&A, to the question comment section from our website, and it goes directly to Keith, and he can answer that for you. So thanks, everyone. We will be ending this session now and hopping over into the revenue cycle one. And I will see you over there shortly. And if not, Ryan will do it by himself.
Yeah,
Thanks,
it might happen.
everybody.
Thank
Bye
you.
now.
Bye.